And South Florida doctors are getting ready to train some of their military counterparts. The U.S. Army sent a team of surgeons, nurses, and medics to train at the trauma center at Jackson Memorial Hospital. Civilian doctors will teach the military doctors how to work as a team while treating a lot of seriously injured patients.
Now, even when there is no threat of war, the U.S. military is constantly preparing for one. Part of its latest plan includes training at trauma centers across the nation. Health and Family reporter Diana Gonzalez is live at one of the places they're turning to, Miami's Ryder Trauma Center at Jackson Memorial Hospital. Diana?
Well, actually, the military looked at dozens of trauma centers across the country and chose 3. One of them, as you mentioned, is the Ryder Trauma Center, and the reason it was chosen is because of its commitment to education, the types of injuries they treat here, and the sheer volume of patients. Gunshot wounds, stabbings, severe burns, crushed organs and bones. More than 3,500 patients with serious injuries are treated every year at Jackson's Ryder Trauma Center. That's why the U.S. Army picked Ryder Trauma as the perfect place to train its surgical teams.
The number of trauma patients at Army hospitals has been decreasing steadily. So we're at a point where we need to really affiliate with the civilian trauma centers in order to maintain our go-to-war skills.
Lieutenant Colonel Tom Newth is a doctor. Lieutenant Colonel D. Jones, a nurse anesthetist. 2 of the 9 members of a medical team permanently assigned to Ryder Trauma. Together with the staff here, they will help train the teams coming through on 30-day rotations starting in January. Their mission, to be better able to do their jobs if deployed, thanks to the experience they get here.
We're going to be using simulators and a variety of different educational tools to try and get these folks ready as quickly as we possibly can. A month is not a long time. Dr. Cohen and his staff are doing this day in and day out, so we consider them the experts, and we're here to learn from them.
Army medics will ride the air rescue helicopter and ambulances as part of their training. While this was all planned long before the events of September 11th,
it just made what we were coming here to do all that more important.
Now, the training agreement between Ryder and the Army is scheduled to last 3 years, maybe longer. Live at the Ryder Trauma Center, Diana Gonzalez, NBC6.
Bueno, y esta semana un equipo de cirujanos, enfermeras y paramédicos del ejército se unirán a los cirujanos del Centro de Traumatología del Hospital Jackson Memorial para comenzar un entrenamiento especial. El objetivo es simple. Los médicos y enfermeras civiles le enseñarán a los responsables de salvar vidas en los campos de batalla cómo trabajar en equipo mientras se trata a un alto número de pacientes seriamente heridos. Médicos de la Marina y la Fuerza Aérea hacen un entrenamiento similar en hospitales de Los Ángeles y de Baltimore.